A new study from researchers at Mott Children's Hospital's Child Health Evaluation and Research Unit finds that looking at risk factors may not be a good way to determine whether or not women should get vaccinated for the human papillomavirus.
HPV stands for human papillomavirus, and it's a virus that's sexually transmitted. It's very common both in men and women, and we know that it's the cause of cervical cancer, genital warts, and abnormal pap smears. We were very interested in trying to figure out if it was a feasible approach to use risk factors to target specific populations of women for HPV vaccination, specifically young adult sexually active women, since this is one of the issues that there seems to be some conflicting recommendations between the Advisory Committee on Immunization Practices and the American Cancer Society. The vaccine is licensed for females between the ages of 9 and 26 years old. The Advisory Committee on Immunization Practices, which is a national organization that provides national vaccine recommendations, recommends that this vaccine is given routinely to all 11 to 12-year-old girls, and catch-up vaccination for women between the ages of 13 and 26 is also recommended. The American Cancer Society has slightly different vaccine recommendations. Like the Advisory Committee on Immunization Practices, they recommend comprehensive vaccination for females between the ages of 11 and 18 years old. But for women who are over the age of 18, they suggest a more selective approach where there's a discussion between a woman and her medical provider to talk about her sexual history, and a decision about vaccination is made based on that information. Our study here at the University of Michigan showed that using risk factors to target specific populations of women for HPV vaccination was not a very good strategy. What we found was that using this strategy left many women who had not yet been exposed to HPV infection unable to receive the vaccine. And this is important because these women actually might derive the most benefit from vaccination, since the vaccine needs to be given before infection occurs. Our results supports the recommendations from the Advisory Committee on Immunization Practices that all women between the ages of 11 and 26 years old, regardless of their sexual or social history, receive the HPV vaccine. So our recommendations based on the results of the study here at University of Michigan would be to vaccinate women regardless of what their sexual history is. Even though the HPV vaccine does provide significant protection against cervical cancer, it doesn't protect against all forms of HPV, so it's quite important for women who are vaccinated to still receive routine pap smear screening, because the HPV vaccine won't protect against all forms of cervical cancer.